Dear students, welcome back. In the previous session, we have discussed about kinetics and kinematics of posture. Now, in this session, we are going to discuss about optimal posture. In the previous session, we have discussed the forces which are generated during posture. So, what are the forces, internal as well as external forces? The external forces are normally inertia, gravitation, and ground reaction force vector. So, when this LOG and this ground reaction force will combine to form an coincident action line or combined action line, which falls through the joint axes. Okay, so because of that, if the joint axis fall through the if LOG falls through the joint axis, then it is highly stable posture. Okay, so if LOG falls through the joint axis, then that posture is referred as ideal posture. That thing we have discussed in the previous session. Okay, so here we are going to discuss about optimal posture. So what is the difference between the ideal posture and the optimal posture? Here, in a normal human being, it is impossible to be in an ideal posture. Why? Because the force of gravity is constantly acting on the body. An ideal standing posture is one in which the body segments are aligned vertically and the LOG passes through all the joint axes is impossible. Okay, but it is possible to attain a posture that is close to the ideal. So that is called as optimal posture. That means, so in the previous session we have discussed that the LOG passes through the joint, isn't it? Then it becomes ideal. If the LOG, which is very much nearer to the joint axis, then it becomes the optimal posture. Okay. Yes, in an optimal standing posture, the LOG is close to but not through, okay, most of the joint axis. Therefore, the external gravitational moment are relatively small. So then what happens to the momentum when this LOG falls nearer to the joint axis? So for example, this is the joint axis. If you consider this is the LOG, this is far away. So now the same thing is the LOG falls very nearer to the joint axis. Then what happens? So the momentum is going to decrease. Then what happens? Here the gravitational extension moments are going to reduced in this case. But in this, if it is far away from the joint axis, it creates more rotational force on the joint. So whenever this LOG comes nearer to the joint axis, then that posture becomes an optimal posture. Okay, so when it is nearer to the joint, what happens to the external gravitational moment? So they are relatively very small. The gravitational moments are relatively small, and this gravitational moment is balanced by internal moments generated by what? By the first thing is capsule, passive, capsular and ligamentous tension, and passive muscle tension or stiffness, and a small but continuous amount of muscle activity. Okay, these are all the structures which are going to counteract this external moment. These are all internal moments. So the internal moment force are generated by these structures. Okay. And the postural control system automatically activates the appropriate muscles to keep the body COG over the base of the support. Okay. If you see in faulty postures, if the faulty postures are habitual and it is assumed continually on a daily basis, the body will not recognize this faulty posture as abnormal, and over time the structural adaptations such as ligamentous and muscle shortening or lengthening will occur. So we should avoid the faulty postures. Okay. Yes, we are going to discuss about that deviation from the optimal posture also in the next session. Okay, how can you analyze the posture? How can you analyze the posture, whether this posture is optimal or not? How can you identify this? How can you analyze the whether the posture is optimal or not? Normally, we can see so many tests are there, but we can't go with all those tests all the time. Okay. And still some researchers and EMG studies are going on still. Okay, so for that reason, by observing itself, we have to analyze the posture. So we are going to analyze the posture in the sideways. Okay, so that is called as lateral view, optimal alignment, segmental analysis. So here we are going to analyze not as a whole body, we are going to take each one of the segments, and we are discussing now about the segmental analysis of optimal alignment. First we will see the ankle and knee, and then we will move on to hip and pelvis, and then we will move on to the SI joints and lumbosacral joints, vertebral column as well as head. Okay. Yes, now we'll see ankle and knee. In the optimal erect posture, the ankle joint is in neutral position or midway between the dorsiflexion and the plantar flexion. So this position is called as neutral position in the standing. That means it is present in the midway of dorsiflexion and the plantar flexion. And if you see at the knee joint, the knee joint is in full extension. So the LOG falls slightly anterior, you can find here, which is slightly anterior to the lateral malleolus here. You can find here at the ankle, anterior to the lateral malleolus, and just anterior to the midline of the knee and posterior to the patella. So posterior to the patella, anterior to the knee joint. Okay. Yes. The anterior portion of the gravitational line relative to the ankle joint creates, what is the movement create in the ankle here now? Dorsiflexion movement. In the neutral ankle position, there is no ligamentous checks which are capable of counterbalancing the dorsiflexion moment. Therefore, muscle activity of the plantar flexors. What are the plantar flexors? Here they have shown here soleus muscle. As we know that gastrocnemius, soleus as well as the plantar is also helps in this plantar flexion. Okay. So now the plantar flexion muscular activity is necessary to prevent forward motion of the tibia. Why? Because it is if you see this LOG is falling anterior to this, then what will happen? Proximal to the segment is going to move anteriorly, but the posture is optimal posture, so it should not dorsiflex now. Extra dorsiflexion should not take place. So that one is prevented by, here is the plantar flexors, here is the soleus muscle. This movement is prevented by soleus muscle. Okay, this is the thing happening in the case of at the ankle joint. Okay, and next one is here. If you see at the knee joint, so here this LOG, if you can see here, which is present on the anterior aspect to the knee joint axis, which creates an extension moment. That means it causes femur to move. That means if already this one is in extension position, if still the femur is going to move, it may go to hyperextension, but it is not an optimal posture will get. So then what happens? This one has to be prevented. So this movement has to be prevented. So that one is prevented by the passive tension created in the posterior joint capsule. So here posterior joint capsule and associated ligaments, which is sufficient to balance this gravitational moment and prevent hyperextension. Little or no muscle activity is required to maintain the knee in extension in optimal erect posture. However, a small amount of activity, if you identify, then maybe we can see some action in the hamstrings. Okay. And activity of the soleus muscle may augment the extension moment which is created around the knee through the posterior pull of the tibia. So these are the actions which are going to take place in the ankle and knee segments in maintaining the optimal posture. Now we will see other structures. What are the things are going to happen in the hip and pelvis? Now we will see in the hip and pelvis. Yes. So here this is the pelvis and here this one is the hip joint. Okay. Now, so the hip is in neutral position and pelvis should be level with no anterior or posterior tilt. So there should not be no anterior and posterior tilt should be present in the neutral hip position. In the optimal positions, lines connecting the symphysis pubis and the anterior superior iliac spine, okay, or vertical, and the lines connecting the anterior superior iliac spine and the posterior iliac spine should be should be horizontal. Okay, this one you people know already. So in this optimal position, the LOG passes slightly posterior to the axis of the hip joint. Slightly posterior to the axis of hip joint. You can see this one is the axis. So this line is falling posterior to the hip joint axis through the greater trochanter. So the posterior location of the gravitational line. Okay, the posterior location of this gravitational line relative to the hip joint axis. Creates an extension moment at the hip that tends to rotate the pelvis, that is the proximal segment, posteriorly, okay, on the femoral heads. Okay, and for this EMG studies have been reported that activity of the iliopsoas muscle during standing, and it is possible that the iliopsoas is acting to create a balancing flexion moment. Here the muscular force is going to act now, and if the gravitational extension moment at the hip were allowed to act without muscular balance, as in a relaxed standing posture, hip hyperextension ultimately would be checked by. So if muscular force is not present, then what are the structures which are going to prevent or check this gravitational hyperextension? Is checked by passive tension in the iliofemoral, pubofemoral and ischiofemoral ligaments. These are the ligaments around the hip joint. These ligaments are going to check this hyperextension at the hip. The relaxed standing posture does not require any muscle activity at the hip, but causes an increase in tension, stresses on the anterior hip ligaments, and increases the magnitude of the gravitational torque and other joints in the body. Okay, so these are the things which are going to happen in the hip and pelvis in optimal posture. Now we will move on to the other segment of the body, that is sacroiliac and lumbosacral joints. So as we know that the optimal position at the lumbosacral joint is determined by the amount of angulation that is present. So we already know that the average lumbosacral angle in optimal erect posture is about 30 degrees. So how this lumbosacral angle is formed? The lumbosacral angle is the angle formed by two lines, one drawn parallel to the ground. So this one draw parallel to the ground, and then the next line which is the superior plateau of the first sacral vertebra. Okay, one is drawn parallel to the ground and other drawn in line with superior to the what you call as superior to the superior plateau of the first sacral vertebra. Okay, so this forms the lumbosacral angle, which forms 30 degrees. Okay, next the optimal lumbosacral angle is 30 degrees. Anterior tilting of the sacrum. So what is the anterior tilting of the sacrum? Well, and the lumbosacral angle results in an increasing in the shearing stress at the lumbosacral joint and an increase in the anterior lumbar convexity. Increase in lumbar convexity. Here what is happening? The sacrum is going to move anteriorly. So what is happening? The above lumbar region. So here you can find this lumbar vertebrae. So the anterior convex, what if the angle is going to increase? So angle is going to increase. What is happening? The anterior convexity of the lumbar region, which is going to be increased. Okay, so if angle is increased, what is going to increase here? The shearing stress. The shearing stress at the lumbosacral joint increases because of increasing anterior lumbar convexity. Okay, when the lumbosacral angle is in optimal position, the LOG passes slightly anterior to the sacroiliac joint. So LOG falls slightly anterior to the sacroiliac joint. The gravitational moment that is created at the sacroiliac joints tends to cause the superior position of the sacrum to rotate anteriorly and inferiorly. So the sacrum to rotate anteriorly as well as inferiorly. So this is the thing which is going to take place. Since the sacral vertebrae form a rigidly linked segment, the moment acting on the superior portion tends to force the inferior portion in a posterior direction. So this will cause posterior direction because of rigidness of this sacrum. Okay. Tension in the sacrospinous and sacrotuberous ligaments counterbalance the gravitational torque and prevents the inferior portion of the sacrum from moving posteriorly. This one is going to counteract by the tension which is created by sacrospinous and sacrotuberous ligaments. The superior portion of the sacrum is kept from being thrust anteriorly by the sacroiliac ligament. That means the sacrum will not move anteriorly. That one is prevented by this sacroiliac ligament. Therefore, the LOG passes through the body of the fifth lumbar vertebrae and close to the axis of rotation of the lumbosacral joint. Okay, so gravity therefore creates a very slight extension moment that is opposed by the anterior longitudinal ligament. Okay, so these are the things which are taking place in the lumbosacral and sacroiliac joints to maintain the optimal posture. If you see in the vertebral column, so in the case of vertebral column, if you can see the curves of the vertebral column, already we have seen that is cervical lordosis, thoracic kyphosis, and lumbar lordosis and sacral, you'll have the kyphotic. Okay, so when the vertebral curves are in optimal alignment, okay, the reference line will pass through the midline of the trunk. So here you can see this is the LOG which is falling in the midline of the trunk. Okay. Yes. And then the location of the gravity line in the vertebrae above the fifth lumbar vertebra is somewhat controversial. Okay. So some of the reports shown that the line transects the vertebral bodies at the level of the first and 12th vertebrae, thoracic vertebrae, and at the odontoid process of the second cervical vertebrae. Okay, so using this frame of reference, the LOG will pass posterior to the axis of rotation of the cervical as well as lumbar vertebrae and anterior to the thoracic vertebrae and through the body of the fifth lumbar vertebrae. Okay, and now in this situation, so the gravitational moments would tend to increase the natural curves in the lumbar. So that means here it causes some extension, and at the thoracic region which increases some flexion, and again here extension. So because of this LOG, but this is not happening. What are the structures which are going to limit such increase is, so, and also where you can find this maximal gravitational torque before seeing that counterbalance. The maximal gravitational torque occurs at the apex of each curve, at the apex of each curve, or at C5 and T8 L3, T8 and L3. Okay, since the apical vertebrae would be the farthest from the LOG. Okay, so that LOG, if you can find, so here the distance between the axis to the LOG is increased there. Okay, according to Kendall, however, believes that LOG passes through the bodies of the lumbar and cervical vertebrae and anterior to the thoracic vertebrae in the optimal posture. In this instance, the stress on the supporting structures would be greatest in which area? Thoracic area, where the LOG falls at a distance from the vertebra. So stress in the lumbar and cervical regions is comparatively less than that of the thorax. Okay, and some of the studies shown that longissimus dorsi, rotator and the erector spinae and neck extensor muscles exhibit intermittent electrical activity during normal standing. Okay, and some of these studies suggest that the ligamentous structures alone are unable to provide enough force to oppose any gravitational moments acting around the joint axis of the vertebral column. So around the vertebral column, not only ligaments, it requires muscular activity to counterbalance the gravitational forces, okay, or gravitational moments. For example, if you see in the lumbar region where the minimal muscle activity appears to occur, so the tension in the anterior longitudinal ligament apparently is sufficient to balance the gravitational extension moment. So this is the thing happening in the vertebral column segment. Next we will see the head. Okay, yes, what are the things which are going to takes place in the head? Now we will see. So in the head, the LOG relative to the head passes through the external auditory meatus. External auditory meatus. Okay, so here you can see the external auditory meatus. Posterior to the coronal suture, here you can find posterior to the coronal suture, and through the odontoid process, here you can find the odontoid process. So the LOG falls anterior to the transverse axis of rotation for flexion and extension. So where it is falling, the LOG falls anterior to the transverse axis of rotation for flexion and extension of the head and creates a flexion moment So the gravitational moment which tends to tilt the head forward, so which is going to tilt the head forward, and which one is counteracted by the tension in the ligamentum nuchae, okay, and tectorial membrane, and by the activity of the neck extensors. Okay, when a postural analysis is being performed, the gravity line should pass through the lobe of the ear. Okay, so these are the things which are taking place in each segments in maintaining the optimal posture. So if you want to analyze the optimal posture in a normal person, okay, using in sagittal plane, you have to consider all these things. What we have seen from ankle to head, you have to consider at what joints, that is the segments, where the line of gravity is falling, and if the line of gravity is falling, what are the in which direction the gravitational moment is taking place, and what are the opposing forces to counteract this gravitational moment. So all these things you have to consider when you are going to analyze the optimal posture. In the next session, we are going to discuss about the deviations from optimal alignment. Thank you.